Hi parents, your child has recently been diagnosed with autism spectrum disorder.
As a parent, we understand what the doctors and psychologists tell you can be overwhelming and confusing, so we're here to help explain some of the terms and symptoms.
We'll explain in 3 parts: diagnosis, symptoms, and future outlooks for your child.
Symptoms of autism spectrum disorder can be present from a very early age. Although symptoms vary widely from person to person, some very early indicators include no babbling or pointing by age 1, no single words by 16 months or 2-word phrases by age 2, no response to name, loss of language or social skills, poor eye contact, excessive lining up of toys or objects, no smiling or social responsiveness. Later indicators include impaired ability to make friends with peers, absence or impairment of imaginative and social play, stereotyped, repetitive, or unusual use of language, restricted patterns of interest that are abnormal in intensity or focus, preoccupation with certain objects or subjects, and inflexible adherence to specific routines or rituals. If autism spectrum disorder is suspected in a child, then an evaluation should be performed by a psychologist. Using standardized tests and interviews such as the Autism Diagnostic Interview and the Autism Diagnostic Observation Schedule, as well as rating forms completed by parents and teachers, an effective evaluation can be made. ASD is made up of 3 categories. To qualify for a diagnosis, a child must meet a total of 6 or more items in all 3 categories, with at least 2 from Category 1 and 1 each from Categories 2 and 3. Category 1 consists of qualitative impairments in social interactions, Category 2 consists of qualitative impairments in communications, and Category 3 consists of restrictive, repetitive, and stereotypic patterns of behavior, interests, and activities. Additionally, delays or abnormal functioning in at least one of either social interaction, language as used in social communication, and symbolic or imaginative play should be present prior to age 3. Lastly, these symptoms should not be better accounted for by any other disorder such as Rett's disorder or childhood disintegrative disorder.
Some of the symptoms and how they affect your child include problems with social communication and social interactions. Often children will be uninterested in activities most children their age typically enjoy, such as sharing toys or playing at a playground. Children with autism often show a lack of interest in social interaction. This could include with siblings, classmates, or parents. Children with autism also lack the normal emotions we would have to some stimulating situations. For example, a family pet dies, your child may not react as sad or upset, but may act amused or have no reaction at all. As well as initiating any interactions, a child with autism may also have deficits in nonverbal communications. This means they won't often use appropriate body language, make eye contact, or use facial expressions. Along with problems with initiating social communications, your child may have problems maintaining relationships, especially with children their own age. A second part of the symptomology that may affect your child are the repetitive behaviors. You may notice your child is happiest when they have a specific routine to follow. In some cases, they may get upset or have a temper tantrum if they don't follow these routines. Obsessing over an object or toy is another aspect of the repetitive behaviors, but is a normal symptom of autism. Having a child with this disorder means your child is often in his or her own world, and it can be confusing and difficult to understand their behaviors. But children with autism are very capable of living a normal and happy life.
Though there are currently no cures for autism, many treatment options are available. These include educational and behavioral interventions, medication, and other therapies. Locally, the IWK offers early intensive behavioral intervention therapy for children with autism. This treatment focuses on the child's social and communication skills by providing one-on-one attention in the child's natural settings, be it at school, at home, or in daycare. The most important thing to keep in mind is that every child with autism is unique and each outcome different. In general, symptoms usually lessen with age, though social impairments usually persist. Some factors have been suggested to indicate a better prognosis, such as early diagnosis and treatment, having an IQ above 50, or having the ability to speak before age 6. Autism research is ongoing, and though no cures have been found, much advancement has been made. Today, a child with autism has a much greater chance than when 30 years ago, leaving hope for the future.
If your child is affected by autism, or if you'd like more information regarding the disorder,
try autismspeaks.org. They offer a free 100-day kit to answer common questions or concerns about the disorder.
For more information on the IWK's Early Intensive Behavioral Intervention Program, call 902-457-5020.